Um, and kidney stones are not smooth. Let me say that. They are, you know, those things that you have in your grass that are like little stickers that poke into your feet? That's exactly what they look like. Yeah. Yeah, so you can imagine that passing through your junk. Yes. I've had several, and I can tell you, they are not fun. They will make a grown man cry and ball up like they got hit by Mike Tyson. It's legit. Kidney stones are debilitating. They say for a man, a kidney stone is the closest thing you can feel to what a woman feels during labor. And that is very, very, very true. Not that I know what labor feels like, but I can tell you exactly what kidney stone feels like, and that is correct. All right. So acute kidney failure, this is a decrease in kidney function, and a lot of times this happens because of infection. Remember I was talking about pre, and post-renal failure. It's reversible with a prompt diagnosis. In other words, if we can fix the problem quickly, it's not necessarily, because you're diabetic or anything like that. It could just be because of infection. And so if we can fix that quickly, we can, get the patient treated, move on, and their kidneys go back to some semblance of normalcy. Okay. Chronic renal failure, though, or kidney failure, is irreversible. And this means that they're eventually going to end up on dialysis. Okay. And they'll have to be dialyzed between 1 and 3 times a week. And there's 2 different types of dialysis. There's hemodialysis, where they actually dialyze the blood. And then there is peritoneal dialysis, where they actually take the fluid that builds up in the abdomen. And usually peritoneal dialysis happens because your patient has what's referred to as ascites, which means that the liver is also failing, and so fluid builds up in the abdomen. And so we actually have to have the abdomen drained off several times a week. Okay.
So they do
liters of fluid.
They would drain
They have a
abdomen.
port in the abdomen, and they literally plug into the abdomen and drain the fluid off of it.
I haven't seen that. I've seen
The kidney, yeah.
Yeah.
Hemodialysis, yeah. Yeah. It's not as common, but it is something that's becoming more prominent because of the number of people who are having liver failure. Okay.
So what's causing it?
Again, cirrhosis of the liver, things like that. The liver's not able to process things properly. The kidneys aren't. And they go into liver failure and have ascites, which is that swelling on the abdomen. So they drain the fluid and the bacteria and stuff that build up in there off the abdomen. Okay. The female reproductive system, gynecological problems are a common cause of abdominal pain in females. One of the ones that you'll see a lot, especially here in the South. I don't know why. They blame it on living under the power lines or whatever, but the truth is, and then of course the foods that we eat, and the GMO that's in the foods that we genetically modified hormones that we're putting in our food. But we're also seeing a high of ovarian cysts and ovarian cysts rupturing, causing sepsis and things of that nature. Lower quadrant pain can be from the ovaries, fallopian tubes, ureters, or the uterus itself. And the truth is, it can be because of what's referred to as an ectopic pregnancy. And we're going to talk about that a little bit. Some other systems that lie in that same region are the aorta. It runs what's referred to as retroperitoneal, or behind the peritoneal cavity. If you have a weak area in that blood vessel, you can form a AAA. That means that you have high blood pressure that is unchecked, and it literally forms a balloon inside your aorta. Okay, they're difficult to detect, and they are deadly. Okay, that firefighter who passed away here in Savannah down on River Street when the dock collapsed died from AAA. Yeah, he had AAA that ruptured right there during the on the scene. Okay. If you suspect a AAA, literally what you're going to do is you're going to place your hand on the abdomen. You're going to feel if you feel a pulse. If you do, stop. Don't press, don't touch, haul tail, because they need to get to a surgeon. Because what's happening is if you feel that pulse, they need to have a stent placed around it so it doesn't rupture. Okay? And of course, pneumonia can cause an ileus. And cause a problem with the undulation of the abdominal pain, of the abdomen, and cause abdominal pain. We say, why pneumonia? Well, because what does a pneumonia do? It causes difficulty with expansion and contraction of lungs, right? and also it causes an inflammation or an inflammatory response, and it can cause that illness. Okay. So if you have somebody that's constipated and having difficulty breathing, they might be having one. Okay. All right. A hernia is where an organ protrudes through the abdominal wall, and you can actually see it bulge out of the stomach. It doesn't necessarily produce a noticeable mass all the time, but most of the time it does. The problem is strangulation, because if the intestines bulge through and stay bulged through, that area of intestine is going to die. You're going to end up with a colostomy bag because they got to cut that area out and try to tie it back together if they can. Okay. And also, you can have what's called a diaphragmatic hernia, where the diaphragm ruptures and your intestines come up through into the thoracic cavity from the abdominal cavity.
Would that be caused from trauma?
Oh yeah.
Yeah.
Oh yeah. Diaphragmatic hernia happens from like car accidents, you hit the steering wheel, things like that.
But it's not normally medical.
No, it's not normally medical. Not normally medical. Not that it can't be, but for the most part, it's not normally medical. Okay. Some of the other issues with hernia, you have a reducible mass that's no longer reducible. In other words, you have something that pops out that you can push back in that you can't anymore. You have pain at the hernia site. Tenderness when the hernia is palpated, and if you have red or blue discoloration to the skin, that means that that thing is that swollen that it's choking off. Mm-hmm. Okay, it's starting to choke it off. So we need to be very careful about that.
It's going to be in the area of where the hernia is?
Yes. Okay. Yes. All right. So let me skip forward here a little bit. Talk about dialysis emergencies. Okay, dialysis is the only definitive and finite treatment for kidney failure, chronic kidney failure. What dialysis does is dialysis filters the blood, cleans it of toxins, returns it to the body, and they give a small amount of heparin, which is a blood thinner, in an effort to help clean the blood. Okay, if they miss dialysis treatment, a couple things happen. One, they have a buildup of fluid inside the body, right? Because they didn't take the excess fluid off. Because remember, the problem is they can't pee. Mm-hmm. So if they can't pee, which is the primary way that the body gets rid of waste, it's got to go somewhere. So it goes into the abdominal cavity, okay? Which is a problem, all right? So a lot of EMS services transport people to and from dialysis. That's a big part of the business because it's Medicare, Medicaid, guaranteed money. So you'll see a lot of that. The problem with dialysis emergencies is one of the things that we see commonly, is you have a dialysis machine that functions like your kidneys does. Some of the adverse effects when you put a patient on dialysis, hypotension, they pull too much fluid off. You have muscle cramps. Why? Because they've become dehydrated because they pulled up too much fluid or didn't give enough fluid back. You have nausea and vomiting because of the fact that they have a potassium shift or they lose too much potassium or calcium during dialysis. And if people go into cardiac, just for side note, if people go into cardiac arrest during dialysis, one of the medications we give them is calcium chloride. We give them calcium because usually that's the thing that causes them to go into cardiac arrest. Okay? And then of course you have hemorrhage at the site of the access. Now, this isn't a normal hemorrhage. Have you ever seen one?
Yes, I have.
Okay. It is like, it looks like a murder scene.
Oh, yeah.
Blood spurting everywhere and yeah.
I went to one a couple months ago for a lady. It happened in her house.
Yeah.
She had it in her arm and it went, and then there was another time I went, a lady had it in her femoral, and she was actually at dialysis when that thing ripped off and it was game on. Mm-hmm. That's the worst one I've seen.
Yeah.
Luckily she didn't go unconscious on us or nothing like that, but we was doing everything we could.
Just to keep her alive.
Yep.
Yeah. And like I said, peritoneal dialysis, like I said, allows for large amounts of dialysis fluid to be infused into the abdominal cavity to flush out the toxins. but they have a very high risk of peritonitis. That's why you don't see it a lot. They have a very, very high risk of peritonitis. So do you have any questions about, or are there any questions about GIGU? I'm going to post the lectures online today, or this afternoon. And what we're going to do now, we're take lunch. You can come back at 1.